Today I would like to talk a little about when should patients being treated for AML get a COVID-19 vaccination booster. So I believe that to better understand this, we have to consider that patients with hematological malignancies are at a greater risk of developing severe COVID than the rest of the population. This is something that we already know to a great extent throughout this whole pandemic. And not only do patients with hematological malignancies have a greater risk of severe COVID, but within those patients, the risk varies a lot. For example, patients, especially with acute myeloid leukemia, have a much greater risk than the rest of hematological patients of developing severe COVID. So this leads us to something very important. We have to distinguish the fact that one thing is the probability of developing severe COVID, and the other thing is the probability of the vaccine being effective, because these two things are not the same. For example, in patients with hematological malignancies, when they are vaccinated, the patients with acute myeloid leukemia have a much better probability of developing a seroconversion or being protected by the vaccine than patients with lymphoproliferative disorders or patients with multiple myeloma, for example. So what we know is that all hematological patients should be vaccinated, should receive a complete dose with 2 doses, especially of mRNA vaccines, whichever you have available at your centers. And then the question is, when should we give the boosters? So that depends on whether the patient is receiving treatment or not. Patients that are receiving currently treatment for acute myeloid leukemia, it will depend on whether the patient is in aplasia at the moment or not. If the patient is at the time with aplasia, we should wait until he has recovered from that cycle of chemotherapy. And after that, we should give the vaccine. If we haven't started treating the patient and he has already 3 or 4 months have passed from the second dose of the vaccine, we should administer the booster according to the CDC guidelines. So it especially depends on the time of treatment, because that is one of the most relevant aspects in AML.